Very much welcome to this Steriking webinar. We're going to talk about our new product, Reinforced Rolls, today. My name is Jyri Mäkinen, and I'm working as a global sales manager for our Steriking branded products here at Vipak. And today we have really great news for you because we're going to introduce our new products, and we believe that this can be really big. We really believe that you could sell these products to all hospitals in the world and even all healthcare facilities in the world. So not only the hospitals, but also other places there. So now we're going to go through this product, and I'm going to discuss, first of all, why do these reinforced rolls are needed in the first place. Then we're going to compare these product features and the materials to the existing materials which are used now for packing instruments. Then we're going to look at available range, how to use these reinforced rolls, and give you some examples of the packing applications where you could use reinforced rolls. So we have collected feedback from the testing in multiple different hospitals, and we have got a lot of comments that what kind of instruments could be packed inside, and we will give you some ideas of that. We are also sharing some testing data, what kind of test has been completed and why it is relevant and how you should be using it for your business. Then go on to marketing materials, what we have, what kind of actions we are going to do as Vipak, and then what kind of actions we would hope you to do as distributors when introducing the product to the marketplace. Also, a little bit looking at the targets from our point of view, that how do we approach this product and what do we expect in the future. Then samples, pricing and availability will be discussed a little bit in the end. Again, warm welcome to everybody. So what reinforced rolls? Basically, there are hundreds, if not thousands of instruments in hospitals and clinics, which may require stronger packaging than in use today. This is because handling and storing conditions are often harsh. So people might be stacking a lot of packed instruments which are packed into the pouches in a very small space, like with drawers or cupboards or some wire baskets, all kinds of places. And then when they are pushing them too tight, there is a risk that the barrier will be broken. Also, there are a lot of shelves and wire baskets and such where they keep these items which might have sharp parts on them, which could be then again breaking the barrier of the sterile pouch. There are people who are handling rough the packages. So after the sterilization, when they are transported, when they are handled, not every people is aware that actually this is supposed to keep items sterile until the point of use. And then there are a lot of heavy and sharp instruments which may punch through the barrier if using existing materials. Therefore, we have been developing a new solution, what we call reinforced rolls, for this purpose. It's been tested now for more than 2 years. It's been a long process. There has been a lot of different steps before we were able to start launching of this. This is answering all these needs or challenges that there are in the hospitals, and we believe that we can really help your customers to perform better with these new products. When we start to look at the materials which these reinforced rolls are consisting of, then we have a film, what we already use today, Multi-X9 film, which is a film that we produce ourselves, and we have our own quality control for that. It's the strongest film in the world. We have tested all kinds of films from a lot of competitors, and no company comes even close to the strength of the film that we have. As you probably know, we have 9 layers structure in the film. So there's a pulpet layer on the top, and then there are 8 layers of different kinds of polypropylenes, which are giving strength and peelability for this material. Then what is going to be different is this paper part. So we are going to use in these reinforced rolls 100 gram per square meter reinforced paper, which is providing superior puncture and tear resistance for this material. And then when we put them together, we get the very strong seals and very good peelability for the product. When comparing this 100 gram paper to other materials in use today, then if we start from the puncture resistance, basically it's kind of a probe which is going through the paper, and it's measured how much pressure is needed to force through the paper. Then we have 2.5 times better puncture resistance with this 100 gram paper than 70 gram paper. There is now somebody's microphone is open. Can you please mute it, because I have a background noise there going on. Thank you. I want to mention that you all know that 70 gram paper, what we use today with flat rolls or flat pouches, is really great. It's much better than 60 gram paper that a lot of the competitors are using. But then this 100 gram paper is still giving even better strength when needed. When we look at the burst strength in the bottom, then burst strength is kind of a maximum uniformly distributed pressure with this device, what you see in the picture, that is needed to break through the paper. And when we compare it to 60 gram paper, the force is even 115% higher for this 100 gram paper, what is needed to break through, and 70% compared to 70 gram paper. So massive difference. Then some markets have seen also the product called Ultra from Sterimed, which is polypropylene-based porous material, and then the strength, burst strength properties of this medical paper that we use for reinforced rolls is 30% better than with those. What does it mean then for your end customers is, of course, that they're going to have less packaging failures. Instruments are not punching through as easily. These sharp items or sharp things that they might have on the shelves is not going through the material as easily as with these traditional materials. Again, looking at the features of 100 gram paper and comparing it to other papers, then the tear strength, basically, if you have an initial cut in a piece of paper, then this measurement is done so that we are testing that how much force is needed to tear the paper from this initial cut. And when we look at the figures, we have 60% better strength for this 100 gram paper than for 60 gram paper, and 40% better than 70 gram paper. And tensile strength, basically pulling the paper from two sides and seeing how much force is needed to break it. We have even 200% better strength for 100 gram paper than for 60 gram paper. And what does it mean then again? This tearing matter, when you open the pack in operating room or in other department, there is less likely tearing happening when you open it. So you will have always the clean peel, and it will be working even better than earlier materials in this sense. And then, of course, when you have a good tensile strength, it takes much more force to push the instrument, even if it's heavy, or the tray through this material when using that. Again, less packaging failures, more efficient processes in the hospital, less claims for reprocessing department, and then it's working in operating rooms, so not disturbing the project or process there. The artwork, we are pretty much following our earlier artwork, what we have with flat rolls. So we're going to have 3 indicators. So we have printed steam indicator, formaldehyde indicator, and ethylene oxide indicator on these pouches. And we're going to use the same lot coding type as we use with our pouches and rolls today. So there is first 2 digits under the lot code is the year, and then next 2 digits are the month. So it will be always easy to see when it was produced, so that people know how long they can still use this product for. The difference to our regular flat rolls is that we are printing this all other information, but indicators we are printing in black color. So this black color is then to differentiate from our regular rolls if your customers will be using this side by side at their department. So they know that, okay, this is strong paper, this is 70-gram paper. Okay, both of them are strong, but then this reinforced is still stronger. Then small thing, but actually very big, we believe, is that we have put a new symbol on the roll, kind of an instrument mark. And an idea of this mark is that when you are placing the instruments into the pouch, or the person, a sterile technician, is doing that, then it's easier for him or her to place instrument right way into the bag. In the paper, you always have certain fiber direction, and then it means that it opens better from one end of the bag than from the other. So then when the person in CSSD is packing the instrument, they can only look at this picture and place the instruments accordingly, and then it will be automatically so that the sharp parts are away from opening direction. We have got some ideas of this from different markets, and we thought it's a good idea. So we hope that this is really making the process easier and faster in CSSDs. Because in earlier days, they needed to check this opening mark, what you can see in the picture on the left side up there, and then decide how to place an instrument there. And then not all the people understand how it is. Also, this will be improving this aseptic presentation in operating rooms or in the departments which are using it, because obviously they will be always opening the bag from the right side of the bag, because the instrument is already placed right in the first place. We're gonna have 5 different widths to start with, starting from 100 millimeter width, and then going all the way up to 500 millimeter width. As you can see from here, there is 100 meters on each roll, and then the sales packaging size is so that every other size we're gonna have 1 roll in a sales pack or in a case, but with RR41 there will be 2 rolls. This is quite easy also for you, we believe, as a distributor, because then you can start selling easily 1 roll in the beginning before they start to use this in big scale. So easy to do introductions of the product and sell to even smaller facilities, easy to sell. The code is marked so that RR reinforced rolls, and then this number behind is following the same logic as we have with other flat rolls. So if we have R41 size is also 100 millimeters, RR41 100 millimeters. How do you use the rolls? Well, you use them the same way as any other paper laminate rolls. We of course gonna have IFU or instructions for use for that. We have it already, and we're gonna publish it on 2nd of October on our steriking.com. And this is because we are now finalizing the registration within this month, and only after that we can put any kinds of materials available from public website. What we recommend, or what is the most optimum, of course, is that your customers would have the roll holder with the cutter, so that you can place these reinforced rolls in the back of the holder, like in this picture. This is very ergonomic solution because they only need to lift these rolls in the back of the device once, and then they can measure the right size of the bag and use the right width of the roll easily from there by just pulling the material out and then cutting with the blade which is in front. So using this, they can avoid unnecessary lifting, and the use of scissors. But of course, if they don't have the roll holder today, then you are happy to sell them. We are happy to sell them. And even if they don't buy, okay, they can use these materials the same way as they use regular flat rolls today. Still to show how this works, so you pull out the material from the roll, you measure the right length with the instrument that you are using, and then cut it by moving this blade sideways. When you have got this, the right size of the piece for your instrument, then you seal it with the sealing machine. And we have a really great news in that sense, because you can use the same sealer and the sealing parameters as you use with other paper laminate products. So you don't need separate sealer for this product. You can use temperatures from 165 to 200 degrees, and this has been tested for the worst case scenario in 165 also, that it's creating the seal. Maybe the most typical sealing temperatures would be around 175 to 185, what we know from the hospitals, but the range is very wide. So we have really a special sealing layer in our film, which is allowing very wide sealing window, which means that you can get a good tight seal with a lot of different temperatures. And that's good news for hospitals, because sometimes they cannot keep the temperature of the sealer very stable, and that is helping them to have always good seals. If we look at the same from the video, this video is old for our normal flat rolls, but just to show you how this happens. And you have an instrument, you pull material out and measure the right length, cut it with the roll holder, and then seal it. In this case, you will check the instrument mark to place the instrument right way into the bag. Then you seal it again. And like with our other rolls, we have continuous seals at the side of the rolls, not like with most of the competitors where they have overlapping seals. That's also very good, because then this is more constant, this sealing strength that we have, and opening features are better this way. As I told in the beginning, these rolls have been tested in multiple different countries, and we were collecting information, kind of a summary sheets of those instruments that were packed. And we got a lot of comments what kind of instruments or things could be packed inside. And here is one that we got a lot of comments about, mollets. So they are used mainly in orthopedic surgery. And here on the picture, I think it's very good picture. This is taken from one of the hospitals. Then on the left side, you have the way that they pack today. So they have a separate tray for the mallet. Then they put tray liner inside the tray. They put tray liner underneath the tray, and then they wrap it with sequential wrapping style. So 2 different layers of the wrap. Obviously, in this left version, this traditional version, they are using a lot of materials. There will be a lot of waste. It's expensive because they need to use tray liners. They need to use 2 layers of wraps. It's also much slower. We have taken time how long it takes to pack into rolls. So if you take and cut from the roll and place an instrument inside and seal from both ends, then it takes about half a minute. Somebody could be doing it faster, but about half a minute. Then when you put the tray liners and this wrapping, it takes something like 1 minute, 15 seconds, even longer. Even if you would not use the tray liners, it would be about 1 minute. So it's a clear saving in time. Of course, on the right side, when it's placed into the reinforced roll, then one can also see into the bag. clear advantage. Then Kerrison rongeurs, I'm not sure how to pronounce this rongeur, but anyway, then there are different types of instruments like these Kerrisons, which are mainly used in neurosurgical, pediatric, maxillofacial, and orthopedic surgeries, maybe in some other surgeries as well. That's not maybe important. Important is that in the end of this device, it's used for cutting bones and tendons and such things. Then this ending there, or the tip of the device, is sharp, and then also the handle part is quite odd size or odd in shape. So it is creating some packaging problems, and it's perfect to place into this reinforced roll. There are a lot of bone cutters in hospitals. I'm even sometimes surprised when visiting hospitals how much they have all kinds of tooling. And these bone cutters, they are heavy, they are sharp, they are odd in shape, and they are perfect solution to put into the reinforced rolls as well. We got a lot of comments out of this. There are K-wires, so these are used to repair fractures, so broken bones. Sometimes they call them pins as well. This is not maybe the most perfect picture or something, but those are long pins that you place inside the patient to help to prepare those fractures. So it's kind of like supporting the bones when they are when bone is forming again. And these need to be, of course, sterile. They don't come sterile from the factory usually, so they sterilize them in the hospital. And this, again, is strong packaging that you can use with this. And then when you have wires, they have a lot of wire cutters also in hospitals, again, heavy. They have sharp parts, needing strong packaging. And we got a lot of comments about this, that reinforced rolls are perfect for that. Here we have triple Kelpie retractor. So there are a lot of different retractors in a hospital, but this one, if I remember right, is used in spinal surgery. So this is kind of like holding back the tissues and organs during the surgical procedure. And it has some sharp hooks here and very interesting shape of the instrument as well, which makes it difficult to pack so that it would not come through the packaging. These hooks there, what you can see from the picture, they are very, very sharp. So actually, it would be recommended to still use tip protectors with these, because then these are so sharp that they could go through almost anything if they come into straight touch with the barrier material. But really, also got a lot of comments about these Kelpies, that reinforced rolls, perfect solution for those. There are surgical rake retractors as well, or rakes they call them. They are again used for pulling back skin, tendons, and other soft tissues during surgeries. And then they look a little bit like forks. So there is a bending or kind of a curve in those prongs, and those prongs are sharp. And again, because of that, reinforced rolls is a good solution to pack these instruments to avoid punctures going through the barrier material. Richardson retractors. These are not so sharp, but they are the shape of the instrument is such that it's creating problems with the seals, and then also some other type of the problems with the barriers, especially when handled rough after the sterilization. Then they have spoon curettes. For these, we also got multiple comments that this is good to pack inside. And these are used for removing granulation tissue and scraping out wounds, for example. And because removing this granulation and other things from during the operation, these spoon parts need to be sharp. And that's why good to put inside to reinforce rolls. Uterine curettes. It's not maybe important where this is used. Maybe they are used for many different purposes. In this case, I think somebody told that these are using removing the tough tissue from the lining of the uterus for biopsy or excision. But then what is important again, that this loop part or the tip is sharp, just to aid this removal of these tissues and so on. And then this demands strong packaging, of course. There are a lot of drills, orthopedic drills, dental drills, all kinds of things goes well into these bags. Then moving to some bigger things, there are of course a lot of different sizes of sets and trays in hospitals, and you can place also those, especially smaller and medium-sized trays, into these reinforced rolls. They are strong enough, and then you can see what is inside the bag, and you're going to have a long shelf life for those. We got at least 3 hospitals who were thinking that this endo eyes, which is shown in this picture, is good thing to put inside. So this is already a very big tray, and it was placed in RR 49. So this is good solution. They can steam sterilize it, they see inside, and they can give long shelf life after the sterilization for this also. Here it is with these bigger packs. Then when opening them, okay, this opening has been made in the CSSD or sterile processing department, so not in operating room like you see. There's no gloves even with one of the persons here. But then with these big bags, you may want to use even 2 persons to open them, just to make sure that these outer parts of the bags are not touching the sterile instruments or the tray, what is inside. What is good in this picture is this is really providing excellent peelability, this materials, so you can peel it open easily. So this 100-gram paper is very stiff, and it makes it easier to open. And as I was showing before, then this tearing properties are excellent with this paper, so it will not be tearing, even with the big bags. Other comments from hospitals: you can pack rinse bowls or any metal hollowware or plastic hollowware inside. Of course, in a lot of the markets, or a lot of you on the line, you already sell text line to this kind of application. So that is a good alternative for this. But then let the hospital decide then if they want to pack also these metal bowls and basins and such things inside reinforced rolls. It was working well in the test according to the comments what we got. So we got really good points from the hospitals for this. Different cords, different shapes of instruments, trocars having some sharp parts. And then some pictures from hospital before sterilization. Again, you can see mullet there. After the sterilization, there are some handles, retractors, curved instruments, and so on. I don't even know the name of these. That's not important. Kelpies again, Calipot, and so on. Now, based on this feedback from the hospitals, we have collected the names of the instruments that have been mentioned by those who've been packing it, and they've been telling that what are the things that could be put inside these reinforced rolls, and we have collected those into the table. This doesn't mean that there wouldn't be other products that you can put inside. Of course, there are multiple other products that you can put inside, but then this is just to give an idea in the beginning, maybe making it easier for you as a distributor also to go to hospital and ask how they are now packing this and that, and then introduce the reinforced roll as a very good alternative for that. Like everything else, what we produce, pouches rolls, we produce them in clean room. So also the reinforced rolls, of course. We produce them in clean room class 8, which is certified according to this ISO standard. And basically, auditor is coming to us every year to measure how much particulates is in a cubic meter of air. And we, during the manufacturing process. And then obviously we need to take care that our production environment is clean and it will be good for the end customers because they will not get products where there would be some harmful substances or particulates coming out when they are used in operating rooms, for example. It makes sense to try to get this as a requirement for tender processes because not all competitors are having certificate for that. A lot of people say that, okay, we have a clean room, but then when starting to ask certificates, there are less companies who have that. Okay, there are companies, of course, there are many companies who have clean room certificate, but because there are also a lot who do not have, you can maybe block out those from the competition. We have done a lot of studies also for these products, or like for all of our products. And to be more precise, because we're using the same material composition for this as for our robotic pouches, a lot of these studies has been done with robotic pouches, and we can use a rationale that these are working exactly the same way. So Lexamed laboratories have made compatibility studies, basically sterilant penetration studies for double pouching, wet pack testing, shelf-life after the sterilization. Shelf-life prior to sterilization, we have concluded ourselves at VPAC. And then ISECA from Germany has been showing the conformance against EN 868 Part 5 and ISO 11607. And then Nelson Laboratories have been doing the cytotoxicity studies for this. If looking at this a little bit more closely, not that precisely, these are long protocols that have been followed, but in the sterilant penetration study, it's basically verifying that the sterilant can penetrate into double pouch packaging and then provide sterility for the packed items. And this is done by using so-called half cycle, which is a very much a worst case scenario. So basically, when using the sterilization temperature, in this case, for example, 135 degrees or 132 degrees, then this minimum sterilization holding time, the time what you have in this temperature 135 is cut into half. So from 3 minutes to 1.5 minutes. And even in this half time, it needs to kill the microbes and spores in this worst case scenario. And then findings are supporting that full cycle sterilization process will produce sufficient lethality to achieve even 12 log reduction. What does it mean in short is that you can do double pouching with these rolls, and sterilant can penetrate into those pouches and kill microbes and spores inside there. Very good to mention to your customers. Another interesting thing is wet pack protocol. Lexamed was also completing this. This is to show that drying properties of these pouches are sufficient. So they were packing even 1.2 or even more than 1.2 kilos in each pack, different metals and plastics, and then sterilizing them in different cycles. And then actually before sterilization, they measure the weight of these pouches, and then after the sterilization, weight of these pouches. And the idea is, of course, that they are not gaining any weight during the sterilization process, so they would not be left wet after the sterilization. And results were showing that moisture content of the pouches do not increase during the sterilization process. And when looking at some of the results, I took one picture of the testing table, then the weight gain was actually on minus in this, so there was a minor reduction of the weight during the process. This is probably because from the paper there is always some moisture content, and when you sterilize it in the drying period, then this moisture content is going slightly down, and that could be a reason for that. Maybe also some of those plastics could affect that somehow. But really good news. So these are providing excellent drying properties, and it's safe to use these for packing instruments in the hospitals. This is really worst case what you see here. So and then need to remember that there are materials in the marketplace which are not providing dry packages always, like some synthetic materials, for example. Then you might have water drops inside after the sterilization, which means that it's not sterile and they need to reprocess it again. Of course, it's fair to say that wet pack related issues are not only related to packaging, but of course the autoclave process needs to work, water quality needs to be good, vacuum pumps need to work, steam generators need to work, and pack assembly and all that things need to be on the right place, as you know. But this is a good study, really shows how excellently these materials perform. Then shelf-life studies. Lexamed was using accelerated aging and real-time aging for this. They used the lowest sealing temperature and the pressure, what we give in our IFU for the materials, to represent the worst case scenario of this heat sealing, so that the seals will be staying intact during the sterilization process. Then they did huge amount of pouches and sterilized them in different sterilization cycles, and then part of the pouches after the sterilization was put into accelerated aging process, and then part for real-time aging process. And after they were placed on the shelves, every 4 weeks, Lexamed is moving them to simulate these handling and transaction activities that are made in the hospitals. And then at each point after 12 months, 36 months, and 60 months, they are testing these pouches for performance properties like seal strength and doing the dye penetration testing. And based on this testing, pouches or these reinforced rolls and pouches, they provide shelf life of 60 months after the sterilization. This is based on accelerated aging. So this is happening in faster process. So these items are kept in temperature of 55 to simulate the real-time age conditions. And this is accepted by the industry. And then this will be confirmed by real-time aging, which is still continuing, of course. At the moment, we have real-time aging 1 year ready, and then the results for 1 year ready, and then 3 years will be completed somewhere next year, and 5 years is going to take longer time. But the good news is that there's a 5 years shelf life after the sterilization for these products. And okay, they need to keep them in good conditions or right storing conditions and so on. But this is a really saving possibility for hospital as well. Cytotoxicity testing then, it's used for evaluating the toxicity of medical device, in this case, pouch, which is made from the roll. And it's basically testing if there would be extracting or leaching some harmful substances or chemicals from our product during the sterilization process, which could be then resulting to cell death or some negative cellular activity, which would be harming possibly the patient or could be harming the person who is using the pouches. Conclusion was, like for all of our other products, that Steriking reinforced rolls are not considered to have cytotoxic effect. And this is important matter, of course, that there are all kinds of materials in the marketplace, and everybody should be proving that there are no harmful things coming out of the packaging, and we have done that. So it makes sense to have this requirement by the hospitals that this kind of studies should need to be completed. then you know that it's safer to use the instrument or the packaging to pack the instruments. Iseka, as I told, is then doing some testing to show the conformance against this EN 868-5 and ISO 11607. So EN 868-5 is the standard for pouches and rolls. It's an only standard that is available internationally. And then this ISO 11607 is the material requirements or setting the material requirements for this kind of sterile barrier systems. So it needs to meet a lot of different things. It cannot contain certain chemicals. It needs to work for the intended purpose and so on. In simply saying, our reinforced rolls meet these requirements set in these standards. Now, hopefully you got a feeling that reinforced rolls, they are working really well for the intended purpose. It can improve the performance of the sterile processing department and operating room. And it's important every time when talking about packaging to your customers to remember that packaging failures are costly and they can lead to infections, extra hospital days, or even to death. So when they are choosing materials, it's important to remember that for example, if there is a broken pack, if there's a hole in a pack and they need to reprocess it again, the cost of one reprocessing of one instrument is something like $3 to $5, and cost of reprocessing one set is about 30 to 50. One extra hospital day is costing $1,000 to $4,000, and then of course death is obviously something that we cannot measure in money. Marketing materials, we are allowed to put them on our website starting 2nd of October after finishing this registration for the product. And this webinar presentation will be placed then on Wave platform. So you can access the Wave platform from our web pages. If you don't have access today, ask from your sales contact. So then from there, you can download this presentation. You can maybe translate it into your own language and then explain the same things to your customers. We're going to send, our product manager, Hanna, is going to send customer letter about this, announcing the new product. You might want to share it with your customers. Maybe you're going to translate it to your customers, to your own language, and so on. We already have brochure for this, which will be placed on Steriking.com to the download section there, like all of our other brochures. They are in PDF form there. It is now available in English and now currently being translated into Spanish, French, German, and Chinese languages. Then we are also updating our product catalog, which is containing all of our products. So we are including these reinforced rolls there, and it will be also available from our website in October, start of October. And we're going to have own section on the website for ARA rolls. So under this sterilization pouches and rolls, there will be own sections for that, and it will be also showing there in the front page as a new product. IFU, like all the other IFUs, we are putting the download section here. So if you or your customers need instructions for use, you can go easily here to download section and download it for your use. We are also going to place a video to Steriking.com. There are already some other videos there, and then we're going to place video about reinforced rolls to Wave Portal, which is our learning environment. Then in October, we're going to start LinkedIn and Instagram posting. We are going to put video there. We are going to put product intros there. And then what we would really ask very much from you is that you would be liking these and sharing these from your own personal accounts, if possible. Put some words or a couple of sentences in your own language so that people in hospitals, in healthcare facilities which are connected to you will get to hear about the products fast. Then, of course, we also hope that you would be doing and wish that you are doing a lot of postings from your own company pages. So you can use our materials for that. And then, of course, it would be very good if you can take pictures and videos where your own customers are using these roles. Because this is then sharing information to everybody. It's a good message to everyone. Now there is a great solution and we can reach a lot of people in short period of time. Then the pictures that you saw and some other pictures are available from our Emmi picture bank. If you wish to have pictures, then please be in contact with your sales contact and we will give you the link to the picture file. So you can take them from there for your use. Now I'm going to show a video about our R&D manager is showing this new product. A little bit about the points there very shortly. So Tommi Kauri, he's been involved a lot in this project, as well as so many other colleagues, Anna, Tanya, Paavo, everybody, and our sales team, of course, who have organized the trials and so on, and you as distributors. So thank you for all participating. This has been good. You are not hearing anything now, but okay. Tommi was not so happy about the video, but it's just simply explaining how it can be used and for in which kind of processes and so on. So that will be also published and need to do also others from many hospitals now in the future when hospitals start to use this. We are attending as VPAC several different exhibitions now. So we're going to attend the World Congress of Sterilization in Belgium, Brussels, end of next month. Then, as you know, we're going to have a Steriking global distributor meeting in Germany before Medica, 12th to 13th of November. And you're going to have a hands-on experience there with these products. You get to feel them, you get to test, you get to pack, you get to make comments, you get to open them, and I'm sure you will get excited with them when you touch them by yourself. And we will be explaining more about them there in the distributor meeting. We will be exhibiting in Compamed side of the Medica. These will be exhibited there as well. Our colleague Mike is attending this DSGV in Germany. We are attending with Jimmy, the CSSD annual meeting in China. There is another meeting in Germany, and then there are a lot of local events that you distributors will be attending. So please take this product up very much there. This is a great opportunity for all of us. Again, these targets, of course, they are always market related. There are different markets, there are different type of customers and so on. But we really believe that these products can be sold to every hospital in the world. So you can approach your existing customers and give them a new solution. And then, of course, new customers. Open the door with new customers who are not using our packaging today. Our intention is really to offer a new solution for them. So it's really helping them. It's not only helping us, but it's helping them in sterile processing department to pack those heavy or demanding instruments so that they get less claims, so that the packaging really works for the purpose. We're also offering perfect solution for those hospital environments where there are rough handling and storing environments. Remember that now we have a product where we basically do not have competition today. Nobody is doing the similar product today. So we want to make a lot of noise about it, and we hope that you are doing a lot of noise about it, because we can gain a lot of customers fast with this. And because it's a unique product, you will have less competition, you will have better profits and higher turnover. And we do the same, of course, from our end. Pricing and samples. Sales managers will be updating your price list by the end of September. So then you have the pricing, and you can start to order samples then and agree then the details with your sales contact. You can get some of them free of charge, but why not to then order already bigger amount in the first place to be able to make trials in many of the hospitals or with many customers, all kinds of clinics and so on. Deliveries of these products we can only start 2nd of October onwards because of this registration matter. Again, everything has been completed, whatever it comes to documents and so on. It's just that it takes a little bit time to get it to the database and finalize all the things that are still needed there. But it is coming and completed this month. Then, because this is a new product and we don't know exactly that what will be the demand in the beginning, and we don't have history of the demand, then kindly please share your forecast and talk about what kind of opportunities you see ahead. Give us this information so that we can then adjust our stock levels and reorder points and production sizes according to the information given. Last but not least, takeaways that I hope you to remember from this webinar. This is now really, this reinforced rolls is a unique product, and it's opening opportunities for all of us. And we would need to take it now, not tomorrow, but now. Really, this is improving the performance of the sterilization department and OR. It will be reducing packaging failures, and it will be leading to savings in total cost. It will make faster packing processes. It will lead to less claims from the customers of sterile processing departments. It will be leading to less tearing when opening the pack. So this is a perfect solution for demanding applications in hospitals and clinics. This product is going to keep instruments sterile during this transportation and storage, even when the environment is tough. And providing long shelf life, which is again reducing the stocking cost what hospital is having. But of course, this can only come strong product when we make sure that everybody everywhere knows about the product. That way we can guarantee the success of the product. Now that was pretty much all what I wanted to say today. I want to thank you for attending this webinar. And if you have any questions now, please make them now. Or if you have any questions, you can also send an email to us, anybody from our sales, to me, Hanna, Tommy. You can ask more details about this if you like.